What are the treatments for hair shedding?
Experiencing hair shedding can make you think that you're losing your hair forever. Typically, this is not the case, as it is well established that 50 to 100 hairs are normally shed every day, most of the time imperceptibly. These hairs that shed aren't permanently lost, as this shedding is a normal part of the hair growth cycle. The hair's root remains and regrows after a resting phase. In some situations, such as the early onset of male pattern hair loss, shedding can be associated with permanent hair loss. If you're experiencing hair shedding that's more than you normally experience, there's usually an explanation. I'll discuss how I manage my patients who are experiencing hair shedding as well as hair thinning. I'm Dr. Amiya Prasad. I'm a diplomate of the American Board of Cosmetic Surgery and a fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. I've performed surgical hair transplants and managed hair loss throughout my career. I'm also the founder of Tricostem Hair Regeneration Centers, which is a treatment system I developed after observing native hair that was thinning, getting thicker, and hair growth occurring while we were trying to improve the healing of hair graft survival of surgical hair transplant using a material called extracellular matrix by the company ACell. Since 2011, we've treated hundreds of men and women with genetic pattern hair loss from around the world every year. In our system, I perform only 1 to 2 treatment sessions, and my patients benefit from thickening of thinning hair and reactivation of dormant hair follicles, with benefits lasting 3 to 5 years or even more, making Tricostem hair regeneration the benchmark of ACell and PRP treatment. A common cause of hair shedding is stress. Since it's the rare person who does not experience stress, it's important to define the level of stress associated with hair shedding. Stressors such as hospitalization, general anesthesia, death in the family, cramming for exams, or severe financial pressure. What can be confusing is that the hair shedding, which is called telogen effluvium, does not occur at the time of the severe stress, but rather 2 to 5 months after the event. Although experiencing hair shedding from telogen effluvium can be quite distressing, treatment is usually not necessary. The hair follicle or root remains intact, and regrowth occurs as usual. There are times when telogen effluvium can result in an ongoing androgenetic alopecia which may not have been recognized prior. It seems counterintuitive to not be limited to one diagnosis. As opposed to Occam's razor, Hickham's dictum, named after John Barber Hickam, a physician who practiced in the 1950s, which I'm paraphrasing, states that a patient can have more than one diagnosis. If I'm treating someone who has both telogen effluvium and androgenetic alopecia, I inform them that Tricostem hair regeneration does not prevent you from experiencing telogen effluvium or stress-related hair shedding. Again, however, you'll still derive the long-term benefits from the treatment of the androgenetic alopecia. Another major cause of hair shedding is called anagen effluvium, which happens most often to people who have cancer undergoing chemotherapy. Unlike the telogen phase of the hair growth cycle, where the hair sheds before entering a resting phase before regrowth, the anagen phase is the active growing cycle of hair, which accounts for 90% of your hair at any given time. Anagen effluvium is usually a side effect of chemotherapy, where radiation treatment or systemic chemotherapy causes an abrupt end to the active growth. This is followed by severe shedding of scalp hair and can include body hair, such as the eyebrows and eyelashes. The severity of anagen effluvium depends on the type of chemotherapy agents being used. Severe hair shedding can occur over several days to weeks, and a total shed of scalp hair is definitely possible. Anagen effluvium is usually reversible without additional medication being needed, as hair tends to grow back 2 to 6 months after the cessation of chemotherapy. Hair shedding is also seen about 6 months after a woman gives birth, which is attributable to normal hormonal changes that occur at that time. It should be evident at this point that most hair shedding conditions are self-limited and do not require intervention. Intervention is appropriate when there is androgenetic alopecia, which causes progressive and permanent hair loss. The earlier you address androgenetic alopecia, the more effective a treatment like Tricostem hair regeneration can be. I hope you found this information from my experience helpful. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.